Hi, it's Dr. Adrian from Advanced Dental Artistry. Accessing super to pay for medical or dental treatment. So life's very unpredictable, and there's many occasions where people need urgent medical or dental treatment but just don't have those sorts of funds lying around. So who can apply for early release of their super fund to pay for this treatment? Well, it's really for anyone, and it's not only for the procedure or the treatment. It can be for medical or dental appointments, and it can also be for prescription medication. And it's not only for the person whose super it is, it's also for their dependents. So it could be, for example, for a spouse. There are certain criteria though that's very important. It must be a life-threatening illness or injury. It is for chronic or acute pain, or chronic or acute mental illness. And it must be treatment that's not readily available on the public health system. Here at Advanced Dental Artistry, we are often dealing with patients who are in chronic or acute pain, and it's really affecting their quality of life. And our aim really is to get them out of pain and discomfort as fast as possible, but to also give them long-term treatment. So the big question is, what sort of dental situations qualify for early release of super? Well, we're really talking about three situations here. The first is actually those patients that have very broken down teeth. They may have been grinding all their life, maybe they've got heavily filled teeth, maybe they've lost a few teeth. However, the foundations of their teeth are sound, the roots are sound, the gums are sound, they don't have any gum disease. And these are situations where we get to keep the teeth. And what we're doing here is we're using porcelain to reconstruct the teeth, not only the bite, but to also, of course, give a beautiful smile. And this is what we call full mouth reconstruction in porcelain. The second group is for those people that have what we call terminal teeth. And this is when the teeth just can't be saved. They may have chronic gum disease where the teeth are getting loose, or maybe they've lost many teeth. They could have decay, infection, or abscesses. And these teeth can't be saved. And these patients know that they are going to lose their teeth, and their only real option is to consider dentures. And the third group is for people that already have dentures. Maybe they've got partial dentures that they're not coping with, or maybe full dentures, and they're finding that the full dentures are moving, they're embarrassed, they can't chew the food they want to chew, and they're really looking at alternative. In the two last groups, the terminal teeth and the patients that already have partial or full dentures, what we do here at Advanced Dental Artistry is a process called All-On-4. And this is when we're replacing all of the teeth with a new set of fixed teeth within a few days. We've been doing this process for over 15 years, and we have a very unique take on this process because of the practice that we have. We have our own theatre, our own anaesthetists, we've got dental technicians, and we've got a lab on site. And the whole idea of this is to have everything in-house. We always finish with a titanium bridge, and we can do this process within a few days. So a patient can actually walk in with either terminal teeth, or they can walk in with dentures, and we can give them a new set of fixed teeth within a few days. We now handle all early release of super applications in-house and are no longer associated with My Super Care. The ADA team has a wealth of experience not only managing but lodging successful early release of super applications. As of the 1st of July 2018, early release of super is now handled by the Australian Taxation Office and not the Department of Human Resources as it was before. And with these new changes, self-lodging is much simpler than ever, and we have set up a dedicated in-house team focused just on helping you access your super on compassionate grounds. We have processes in place to guide you through the whole process, and the ADA team will work with you to lodge your application. It can seem daunting at first, but if you're in chronic pain or your teeth are no longer fit for purpose, you will without doubt qualify for early release of your super. And with our systems in place, you can access what is after all your money. For further information, you can visit the ATO's website on early release of super on compassionate grounds, and we will provide the link below. Or please give us a ring at 1-800-SMILING. We have a dedicated team that will be able to answer all of your questions.